Head lice are small, wingless insects which live in human hair, scalp and feed on humans' blood. Nits are the eggs of adult head lice, and they often take about a week to hatch. This video presents head lice. What you need to know. Causes. Carrying head lice doesn't mean that your child or your home is dirty. Sometimes, they just spread from person to person when they are in close contact, such as sleeping in the same bed or wearing the same hat with the affected person. If you use a comb or hairbrush which has nits on, you might get head lice, too. Generally, head lice are more common among children, as their heads are often in close proximity to each other. Some kids get head lice several times a year. You shouldn't be worried if your children get head lice, they are technically harmless and don't carry any diseases and infections. Symptoms. The most obvious symptoms of head lice are itching and scratching. Besides, you can also notice sores and red marks on the scalp. However, many children don't show any of these symptoms. Apparently, there are tiny oval-shaped eggs attached to the hair root near the scalp. They are called nits, divided by the colors white and brown-black. The white nits are eggs that have completely hatched, and the brown-black ones will hatch around 7 days. White nits indicate that you might have an old head lice infection, so it can't be certain if your kid still has an active infection. To exterminate all the lice, you have to find all the live ones and their nits, because when the live lice still exist, they keep laying nits, and the cycle keeps rolling. When finding the lice, remember that live head lice are very fast, so you need to divide your child's hair very quickly, or use the wet combing method to catch the lice. Treatment for the first head lice. All family members need to join this process at the same time. There are 2 ways to treat head lice: anti-lice hair products and wet combing. Anti-lice lotions, liquids, and creams. Anti-lice products such as lotions, oils, and creams work more effectively than shampoos, and you can easily find them from your pharmacy. Remember to follow the product's instructions carefully because your child may be distasteful with a strong smell or allergic to some ingredients. Roughly 1 week after the first lice treatment, your child should be treated again to kill the rest of the live lice and eggs. Head lice can be chemical resistant in several products, so you should check whether the product is effective after using for the first time. If the answer is no, another product with different ingredients such as permethrin, maldacin or pyrethrin should be considered. The best way is to consult your pharmacist for more suggestions. Wet combing treatment. This method includes combing wet hair with a special fine-toothed metal lice comb and hair conditioner, which can be found in any pharmacies. Here are the 4 steps to follow. Apply a good amount of conditioner to your child's wet hair. Rub it into the scalp and along the hair shafts. Wait at least 15 minutes. The conditioner suffocates the lice and makes them release their claws from the hair shaft or scalp. Use the comb to separate the child's hair from the conditioner. Put the comb softly on the scalp and brush tightly down. Use a tissue or tap water to wash the comb between strokes. Comb your child's hair thoroughly at least twice. Repeated several times, this method shows great results. You should comb every 2 to 3 days for 2 weeks until it shows no evidence of live lice or eggs. It often takes more than half an hour for each wet combing treatment. While combing your child's hair, you can allow your child to do other activities such as reading books, playing games or watching TV to keep them staying still. Treatment for head lice is repetition. Head lice can come back if your first-time treatment is ineffective. Their persistent nature may be troublesome for both the children and their parents. In case your child gets head lice for more than 3 times per year, you should meet general practitioner for a new head lice therapy. A medication called ivermectin is also known as an effective way to prevent head lice from children. Prevention. It's easy for head lice to spread among classmates and family members. Therefore, when you find signs of head lice on your child, give the whole family a meticulous checkup. People sharing bed with the affected one need immediate treatment regardless of the symptoms. Don't let your child share hats or hairbrushes with others, and ask them to clean their hair 2 to 3 times a week. Your child is unlikely to get head lice from things like furniture, pillows and carpet. But if someone in your family has head lice, you could consider washing any clothes or bedding the person has used in the last 48 hours. Use a hot wash cycle and dry things in a hot dryer. You could also vacuum carpets and furniture. Never use pest control sprays because they can cause harm to your children. Combs, brushes, hair bands and sports helmets need to be soaked in very hot water, 130 degrees Fahrenheit, for 10 minutes after symptoms of head lice found in your family. Do you know other effective treatments for head lice? Tell us in the comments section below. Thanks for watching. If you find this information useful, please give us a thumbs up and share it with your friends.